So you've been dealing with low back or hip pain and it's starting to work its way down your leg. Maybe it's just pain and tightness, or maybe we're starting to have some numbness or even burning pain down the leg. Anytime we have nerve pain, it can be pretty scary, and there's a few different causes for this. So the first thing we'll do in the office is go through a detailed exam to make sure that what we're dealing with is what we think it is. And today we'll talk about one of the causes, which is called piriformis syndrome. There is a muscle in the hip called the piriformis that the sciatic nerve, that nerve that runs all the way down your leg, actually pierces. And when it becomes tight, it can mimic a lot of different conditions, including a disc injury, which can be scary. Once we've determined that this is the issue, we're going to go ahead and take a look at all the joints around the area and throughout the body to make sure that all of those are moving through the range of motion that they're supposed to be. Sometimes these will become restricted and we need something like a chiropractic manipulation, or if you can't handle that, we'll do a gentle mobilization to make sure that those joints are moving well. Then we're going to go and address that piriformis muscle and other muscles around the hip that may be tight and causing some of these issues, which could look like me using my hands or tools or needles or cupping or any of the soft tissue therapies that we offer to make sure that we decrease some pain and increase that range of motion. Now, once we have this hip joint moving better how it should, we need to go and do some exercise to make sure all of this good work sticks. So let's take a look at a couple of the exercises we may do for this. Once we've done our work in the treatment room, you're going to come out and see if we can open up this piriformis muscle a little bit more on your own. You're going to start by bringing one foot up near your butt. The other foot's going to come up and over. You're going to grab onto that leg. And goal number one is driving this hip back towards the floor. You should feel a stretch all through the hip there. Then you can lean away to get a little bit more stretch. And you want to find a stretch so you feel it, but you can continue breathing. And we're going to hold this position for 2 minutes per side. Now, once you open this up quite a bit and this gets pretty comfortable, we can turn this into a strength exercise by driving ourselves further into that stretch and then pushing our foot into the floor to push yourself out of it. But in the beginning, I just want you doing these holds for 2 minutes per side. Next, we're going to come into a 90-90 position. This is very similar to the pigeon stretch that most people see like this, but this can a lot of times irritate the knee and the front leg. 90-90 position seems to be a lot safer. And from here, we're going to work on closing off and pushing ourselves out. So we want to bring this leg and our stomach here, our abdomen, closer together. As we do this, you want to focus on a long spine. If someone was pulling your hair and lengthening your spine, that's the position we want to stay in. You're squeezing all of these muscles in between here to pull yourself down into that stretch. Now, when you squeeze and squeeze and squeeze and squeeze and get about as far as you can go and you feel a stretch in the back of the hip, you're then going to push your knee into the floor to push yourself back off. Now, if we can, we're going to work towards taking our hands off of the floor, pushing yourself back up. And if that gets too easy, you can even go overhead with the hands and we'll pull ourselves all the way down, push the knee into the floor to get yourself back off. And it really only takes between 5 to 8 reps of this to really get that gluten piriformis lengthened. Now, these are common exercises we might use for that sciatica, but it really depends on what we find on your exam. Your treatment needs to be tailored to you, so go ahead and get on the schedule today so we can do that exam and determine exactly what it is that you need and give that to your body.